Laura Maloof Miller. Welcome to the November Wellness webinar. Kristen Kayla, as you know, is also on the line with me. She's the host of the webinar today. Just a couple of housekeeping items before we begin. The participants are muted upon entering the webinar, and of course, that's to prevent any background noise. Also, at the end of the webinar, there is a short anonymous survey, so your feedback is greatly appreciated. If you have any questions throughout the webinar, go ahead and just use the chat function. And everybody who registered for this webinar will receive a link to the recording in just a few days. And next slide, please. A very timely topic today is loneliness and your health as we move into the holiday season. This is an important topic, as well as the Surgeon General has called loneliness a U.S. epidemic. Next slide, please.
Oops, sorry.
And just our disclaimer, please keep in mind the information provided in this presentation is intended solely for the general information of the audience. It is not medical advice and shall not replace consultation with your physician or other qualified health provider. If you have any health-related questions or problems, please seek the advice of your physician or other qualified health provider. So please now welcome our presenter, Katie Keckman.
Thank you so much, Laura. So again, welcome to our Loneliness in Your Health workshop. Loneliness is really more than just being alone and socially isolated. And today's conversation is going to explain the symptoms of loneliness and tips on just how to feel better. And as Laura mentioned, it's holiday season, so I'm sure many of us experience loneliness, and definitely during the winter months. And my name is Katie Keckman, and I'm a senior health education specialist at Sharecare, and I'll be leading our time together today. And if you have had the opportunity of joining before, you probably know the format of the presentation. But if this is your first webinar that you've joined, I just want to let you know that at Sharecare, we have elevated our webinar experience. So it's more of a video format, and it'll include interactive activities and, of course, group discussion. So if you feel comfortable sharing, I would love to hear from you. I'll ask some engaging questions, but please feel free if you have any reflections, thoughts, questions after any of the video segments, please feel free to type in the chat. So displayed on the screen is our agenda, and we'll first talk about what loneliness really is, and then we'll discuss the idea of resilience to loneliness and how to treat loneliness. We'll then go through what a hug can do, and I gathered some key takeaways from today's workshop that I'll share at the end with you. And please know that if you at any point want to take a screenshot of the presentation, or any of the discussion questions or things that you want to reflect on later, you can always do that. So I'll get started with our first video segment. What is loneliness?
Let's unpack loneliness, but I want to separate it from depression. Sometimes loneliness and depression can go hand in hand, and sometimes they don't. Loneliness is a subjective quality of being alone, of not being understood. And what I want to stress is that loneliness is not the same thing as social isolation. The way they're different is that loneliness is a subjective quality where you can be in a room full of people and still feel lonely, or you can be completely socially isolated and not feel alone. So loneliness has higher rates of depression because it causes us to go inward. And that's what happens in depression, where a person starts to perseverate, ruminate, and fixate on negative thoughts. When a person experiences loneliness, they feel sometimes, in severe cases, hopeless, helpless, and unable to change the situation around. Depression also has a feeling of helplessness. where a person then starts to question their self-worth. So in my mind, loneliness starts to turn into depression when you start to question, what is your purpose on earth? Why are you here? And specifically start to think negative thoughts, to feel like you don't add value into other people's life. And when all of these negative feelings and loneliness start to manifest in the way that you function, to the point that you don't want to get out of bed, to the point that you don't have energy, you're not interested in the things that you used to be, you avoid people, then I start to say, is this loneliness leading to depression? We know that loneliness puts you at risk for almost every medical illness out there. And on the other hand, having meaningful social connections can be a buffer for a lot of medical illnesses. So we know that people who have social connections recover better from everything, from stroke to surgery, a lot of medical illnesses. One of the key forms of treatment, in fact, is having rich social network.
And I do just want to let you know, if you do happen to miss something from a video, that I will be recapping afterwards. So we just heard about loneliness and what that is. And sometimes loneliness and depression can go in hand. Other times they don't. It is ironic. I was talking about this with my brother yesterday. He unfortunately has really bad asthma and a chronic illness and is struggling. So he's been socially isolated, but he was sharing how he didn't feel lonely because he knows that he's loved and he has support, but he is trying to avoid getting sick and being around people. So it's really a subjective quality that's not the same as social isolation. And so I'm sure many of us, I can certainly relate. It's really when you can be lonely even if you're in a room full of people, and especially if you're surrounded by people where you don't feel seen, heard, or understood. Or you can be socially isolated and not feel alone at all. And loneliness and depression can, she mentioned in the video, cause us to go inward. And I think that's where some of us struggle more than others to actually be alone and kind of sit with our own inner turbulence. And the problem is when you have that kind of negative downward spiral of ruminating and fixating on negative thoughts. So oftentimes when a person experiences loneliness, they might feel hopeless, helpless, or unable to change their situation, kind of out of control, which definitely can lead to stress and depression. And depression has a feeling of helplessness where you might start to question your self-worth, or when you start to question your purpose and impact in the world and other people's lives. So that's why feeling lonely can often lead to depression. So it's something that you do want to be mindful of, which we'll talk about throughout the presentation. And we'll also kind of unpack, or we will unpack and talk a little bit more about the conditions, but feelings of loneliness does put you at risk for other medical conditions. That being said, on the flip side, having strong social connections can also act as a buffer against certain medical conditions. So people who have positive, meaningful social connections do tend to recover better from everything. And we all know life is going to happen and things are, stressful things and events are going to pop up. So it is important that we cultivate a social network and foster that so that when things in life happen, we have someone to lean on. One of the key treatments for many conditions is having a rich social network. So here's some loneliness facts on the screen. You can feel free to take a screenshot if you want. I'd also love to hear from you if anybody wants to share if they can relate to any of these statements or want to share your experiences. You can be in a room full of people and still feel alone. You can be in a room by yourself but not experience loneliness. It can evolve into depression and put you at risk for medical conditions. And staying connected with others will help with loneliness as well as help with other medical conditions. I'm gonna read some. Will you have the slides or recording available later? I missed the first 10 minutes. Yes, this webinar is being recorded, so you will be able to revisit it. And according to the CDC, loneliness is the feeling of being alone, regardless of the amount of social contact. So kind of in line with what we have been saying. And social isolation is a lack of social connections. And a report from the National Academics of Science, Engineering, and Medicine noted that more than 1/3 of adults aged 45 and older feel lonely, and nearly 1/4 of adults aged 65 and older are considered to be socially isolated. Older adults are at an increased risk for loneliness and social isolation because they're more likely to face factors such as living alone, the loss of family or friends, chronic illness, and also hearing loss. So we'll talk a little bit more about that after we watch our next segment. But I'll just pause. I see a comment. Is low self-worth always a sign of depression? Not necessarily. I think to be clinically depressed or diagnosed, involves at least 2 weeks of affecting a variety of different factors, like that are mostly focused on kind of basic needs, like your sleep, increased or decreased appetite, loss of interest in things that you typically enjoy. So, low self-worth can be linked to self-esteem. I mean, I do think it's a risk factor for depression. Yes, fact number 2, especially resonated during our pandemic sheltering in place. I couldn't agree more. I am as extroverted as somebody could be, and I live alone and then post-COVID work from home. So I definitely think it's taken me about 3 years to acclimate and adjust to that lifestyle. And we'll talk about, so this is very relevant to my life. And we'll talk about ways to combat that when we talk about how to treat loneliness. So let's move on and learn about the concept of resilience to loneliness. You're going to read words on the screen, but they won't be spoken out loud. They're just going to be background music, and I will recap afterwards in case you miss anything. Okay, so we talked about, or we just learned about resilience to loneliness and how age affects resilience to loneliness. And according to the researchers at the National Opinion Research Center, loneliness peaks as people age into their 80s and 90s. And with the oldest baby boomers in the US currently in their 70s, which are my parents, many will soon feel their resilience to loneliness begin to decline. And it isn't until the losses begin, to increase in the much older age and having the loss of health and mobility, the death of spouses, family, and friends, that people begin to really not have the same resiliency or be able to bounce back, and that's where really loneliness spikes. And a separate study conducted in the Netherlands also found that their loss of resilience can be caused by a lack of sense of control. And that's definitely a big factor for stress. Older adults today need to develop problem solving and goal setting skills just to be able to sustain satisfying relationships, and also to be able to reduce loneliness. On the other hand, young adults who experience loneliness build like as the video said, a repertoire of resources. So like a toolkit to strengthen their resilience as they age. So according to a laboratory director from the University of Chicago, young adults can figure out a way of navigating their loneliness. So you can figure out a way of navigating this world and obtaining the kinds of social connections that you specifically need, so that loneliness levels peak in young adulthood and then they decline after that. So that's where I was saying now, and especially it's easier when things are going well in life and harder to do when you are kind of in survival mode or stressed out or depressed, be able to cultivate that support network, which we'll talk more about as we move through. So here on the screen, we have some tips of how to bounce back from loneliness. So connect with other people in the community, set goals and connect with others who have similar goals as you. Share problem solving and goal setting with one another. What worked for you might work for somebody else, and keep connecting. So as an example, as I mentioned, very extroverted. I now live alone and work from home since 2020. And it's very important to me to have human interaction throughout the day, or I do notice that I feel lonely or down. And I do try to plan, I look at my week ahead of time on Sunday and try to find open pockets where I can maybe get coffee with a friend or go on a walk with a friend. And I do my best to build in, outside of my 9 to 5 hours, activities with friends, working out with somebody, after work, and weekend events with friends, family, loved ones to combat loneliness. Does anybody want to share if they currently do anything like this and how it's benefited them, or do you plan to? Or do you want to share a goal that you've set to combat loneliness or stay connected to others? Maybe that's joining a book club or an online support group. Somebody said, sorry, I got more comments. How can my mom find something to live for, enjoy in life, if several strokes took manual dexterity she used to rely on all of her hobbies? She also can only eat pureed food, so can't enjoy any invitations to social gatherings, which invariably involve food. And again, anybody else who wants to answer that or chime in, please. Someone else said pickleball. I have played that a few times. That's a good suggestion. Yeah, and I even just think walking with other people could be helpful. Just not being alone all the time, or finding something that she is able to do. Music is something that has connected me with other people, and it sounds like she playing an instrument or learning would be challenging. But I'm trying to teach myself how to play guitar, so I was trying to think of something not active, because also a lot of my hobbies are active. But does anybody want to share different tools or activities that they're currently participating in? I do think, especially if she does not want to go in person, there's also online communities that she can connect with other people in a similar place of life, especially if she does not want to go in person to social gatherings. Like I said, a book club or reading. Cultivating the skills of resilience against loneliness seems like a psychologically analogous version of physical weight training in terms of practicing to stay healthy. It's an astute observation and connection. I always invite my single sister to join our family. Yes, I am single, and I think that is much appreciated, because I think holidays are harder, and yeah, definitely just a day-to-day. Like, most of my friends are married with kids, so I definitely can relate to that. I ended up renting an office with 2 others to get out of the house and have communication with them along with meeting new people. Even though it costs money per month, my time is spent much better now and totally worth it. My mom meets with a group of ladies once a week for a game day or lunch. I also think, and my mom does the same thing. I love that. My mom also has a virtual call with her friends because they're all scattered around the country. So that's also something. It doesn't always have to be in person, kind of like what we did when we were social distancing during COVID. I still use a lot of those tools and techniques. I FaceTime people throughout the day or when I'm eating lunch. I'm an introvert, but work from home became more isolating to me as well. So I make a point to visit my parents at least once during the week and go to the gym during lunch to be around like-minded people. I do the same thing. So that's really great. Thank you for sharing that. Join different groups, maybe a support group. And again, sorry if I don't get to your comments, but just to be mindful of time, I'm going to keep moving. But if we have more time, I will come back. But thank you for your thoughtful comments. Someone said, if you have a dog, go to the dog park. Yes, I have one around me that's very popular. It's in Bark Social. All right. Well, thank you, everybody. So our next segment is how to treat loneliness. So all related.
If you're feeling lonely, know that you are not alone. And believe it or not, it is much easier to treat or address than you actually think. However, it does require you to be proactive. So I want you to keep that in mind. Loneliness can be a cycle where the more lonely we feel, the more we get into our heads, the more negative thoughts we start to have, and then we withdraw, and then we socially isolate. So I want you to know that although you're not alone, I am going to ask you to be proactive to break that cycle. Let people know how you feel so that you and people that you love can help you get out of it. I know a woman who was having surgery. She's single, in her 50s, lives alone. She said, I just need, when I get home, people around me. I'm not expecting anyone to take care of me, but this is my calendar for the next 7 days. And can you please, she sent out a mass email to her friends, book one evening, each of you, where you can come and sit with me and we can just hang out, eat, laugh, watch a movie. And I thought to myself, this is so creative. This is so proactive. This is so helpful.
So as we talked about, it's really important to recognize that you're not alone, even if you feel lonely. And loneliness is very treatable, but it does require you to be proactive. And it can often become a negative feedback loop where you feel lonely. Then again, it's causing that negative thinking and the isolation, and then you don't want to reach out and you're less proactive. So it's really important to be proactive to break that cycle, to let people know how you feel, reach out to loved ones, be vulnerable, open up, make plans with friends, family, neighbors. So now we see on the screen what situations make you feel lonely. Talked about this a little bit, and how can we be more proactive in that situations. We did talk a little bit about this, or I shared that very extroverted, post-COVID, working from home, huge challenge for me. And I do FaceTime my friends, especially those who I also know work from home, or plan like a walk at lunch with them or coffee date, making plans after work, weekends. I've joined, like I teach yoga, so I have my yoga community. I joined a climbing gym since that's one of my hobbies, to surround myself with like-minded people, as one of our friends said. And those are things that I particularly do. We'll talk about this in the next segment, but I also feel like human touch is very important to me, and living alone and working from home. So I always ask my friends for hugs when I see them. So that's just one way, which we'll talk a little bit more about. But if anyone wants to share any tips that they have not, let's see. I became a widow in August after 38 years of marriage. I'm so sorry to hear that. I was very happy that my sister invited me to join her in-laws for Thanksgiving. I'm so happy to hear that too. I always recommend meetup groups for my beneficiaries as well. The dog makes me get up and go walk every day. I'm glad for this webinar. I will choose to start back socializing. I have to have shut down since 2020 and lost friends via isolation. I needed this. I'm so glad. Joining a fantasy football league. Oh, that my brother does that. He has a dynasty league where it never ends. In a group chat with friends, league members, and weekly pickleball with friends. Those are really great ideas. I'm also an extrovert. I always try to have at least one social interaction coming up on my calendar. I'm facing a week of just working at home and I feel very down. And it's good to pay attention to how you feel and then know what you need to do. So that definitely happens to me, especially when I'm busier. And I just, again, know what I need to do. And I have to reach out and be proactive and take that initiative. Social groups, I tap dance, both exercise and social time. Yes, beautiful. I love that. Yeah, that's kind of where I have my climbing friends, my yoga friends, my lifting friends, and I get my workout in while also being able to hang out with friends. Holidays are really tough for me since I have traditions not shared by others. So I try to share part of them with neighbors or friends purposely, and I am the initiator. I also feel the same after my brother got married. I have a very small family and our dynamic has changed. And again, being single and not married and without kids, I definitely can relate to you. And so I do always, and I'm had a breakup recently, so I try to plan ahead on holidays and make sure that I have somewhere to go. But I definitely reach out to loved ones and ask what they're doing and if they mind if I come and what can I bring. Attending community events at libraries can be encouraging and uplifting. That's a great suggestion. Well, thank you all for sharing and for your vulnerability. Let's move on and learn what a hug can do for you.
Hugs boost happiness because they stimulate the release of oxytocin, which is nature's feel-good, warm, fuzzy hormone that produces these feelings of trust and generosity and, of course, happiness. So the clincher is that it needs to be a long hug or a lingering hug. Just a quick pat on the back will stimulate the release of some oxytocin, but probably not as much as you want.
So hugs boost happy chemicals and produce oxytocin. As she mentioned, it does have to be lingering or a long hug to be beneficial. I read that a hug needs to be for 20 seconds or more to really to get the full benefits of the hug, to get that feel-good hormone oxytocin. And that's released to create stronger bonds and connections between the huggers or people hugging. And oxytocin has been shown to boost your immune system and reduce stress. So especially if you're feeling lonely or depressed, find a friend or somebody to hug. So here's your homework assignment. You didn't think you were going to get homework, but you want to give somebody a long hug today and see how it makes you feel. And if you are dealing with feelings of loneliness that just won't go away, you can talk to your doctor or a therapist or another healthcare professional. Chronic loneliness isn't limited to feelings of social isolation and alienation from others, as we talked about. It's often tied to ongoing and deeply rooted negative beliefs about yourself, like our friend who asked about the self-worth. Like, that's definitely a risk factor, and that can lead to other medical and emotional problems as well. So make sure that you are proactive, you take the initiative, let somebody know what's going on, and engage with other people in a positive, healthy way. Even though it might be difficult, try making the effort to connect with other people. So all you guys gave great suggestions in volunteer, hobby clubs, workout groups, online virtual communities, other opportunities can help boost your self-esteem and provide a safe and satisfying way to connect with other people. Also, get some sunlight and exercise if you're feeling lonely and depressed. Getting active and out in the sunshine can help elevate your endorphins and your serotonin. So those brain chemicals can boost your mood and improve your sleep and make you feel happier. Because typically, you know, when you're feeling lonely or depressed, those are things that need to be boosted. So find a support group, especially if chronic loneliness is a side effect of some other issue that you might be dealing with, like substance abuse or the loss of a loved one, as somebody shared, like loneliness from maybe a divorce, a death, a breakup. a chronic or isolating illness, receiving support and encouragement from other people who share similar feeling can really help ease your symptoms of chronic loneliness. And as I mentioned, if you are dealing with long-term loneliness, the kind that just doesn't go away and it's not really short-term, I do think it's important. Don't be afraid to seek professional help or talk to your doctor or another healthcare provider, because that really can help and they can give you suggestions. And it's really just not feeling alone. If left unchecked, it can really put you at risk for other serious health conditions. So here are some takeaways from our presentation today. Being physically alone and feeling alone are not the same things. Social isolation doesn't equal loneliness. And the older you are, the harder it is to bounce back from the feeling of loneliness. So you want to make sure that you stay connected with people and as well as younger people in your life. And to combat feelings of loneliness, you have to be proactive and take that initiative. It might feel challenging at first, but like with anything, the more you do it, it'll get easier and it's not impossible. And then lastly, hugging can boost your happiness. If you're feeling alone, ask somebody for a hug. You can take a screenshot of this if you need the reminder. At this time, I'll open up the chat for just the floor for any questions, comments, thoughts that you'd like to share before we wrap up the presentation. And I am going to turn it back and we'll learn some HealthNet resources that we have to share with you. So I'll pull up those slides. But thank you so much for joining me today. I hope that you feel inspired to be proactive during the holiday season and be open and vulnerable and let people know how you're feeling and that you want to be connected. For those of us who are parents of young ones, speak with other parents who go to your kids' schools to set up play dates to interact with other parents. I read a quote by Virginia Satir that people need 4 hugs a day for survival, 8 hugs a day for maintenance, and 12 hugs a day for growth. Oh man, I am definitely not getting that. But thank you for sharing that. It's a good stat. I'm so selective who I want to hug from, LOL. Even though I love all my friends and family, there's only select few who I will hug for a long time. I definitely understand that. So find a safe person or somebody that you do want to hug.
All right, thank you, Katie. That was a fabulous presentation. I just wanted to go over the next slides. These are on programs that HealthNet members have access to. So, of course, our members can find all of these wellness programs and other resources when logging into their HealthNet account. And next slide, Katie. Okay, so the health risk assessment, now this is designed, gives you a snapshot of your health status in some key areas, as you can imagine, like nutrition, exercise, emotional health, and financial well-being. It's a great starting point if you're looking to identify some health habits that you're doing great at and maybe some that could use a little bit of improvement. You get a personalized report. A lot of times those results will also include recommendations as well. Next slide. Health coaching is also a great way to get support when you're trying to make some lifestyle improvements, such as managing stress, eating healthier, maybe quitting smoking and others. It's really great to have supportive family, friends, and also a coach to help keep you motivated. So if you're interested in that, we have that available. Next slide. All right, the craving to quit. So this is HealthNet's tobacco cessation program. So these types of programs are designed to help users who are ready to permanently break their addiction to tobacco. So if that is you, we have that available as well. The next slide. So we're getting ready to go into the holidays. We've got Eat Right Now. So this helps to focus on healthy eating habits rather than dieting. In this program, the topics will include things like triggers, cravings, healthy habits, and also emotional eating. All right. Do we know life is stressful? So if managing stress is part of what you're trying to do as far as building maybe in a healthy habit, so this program helps to focus on de-stress so that it can help you stay in the moment. So it's about mindfulness. This program has tools and videos and modules that help guide you to build resilience and to decrease chronic stress. This program is open to both HealthNet and non-HealthNet members. And our HealthNet members, take advantage of our discounts. We have discounts on weight management programs, also discounts on chiropractic and acupuncture services, eyeglasses as well. Maybe you need another pair of prescription sunglasses or computer glasses. We also have discounts to the hearing aids, including screenings, and our fitness club through the Active and Fitness program. That program gives you access to the gyms in the network, and also they have on-demand programs as well. And we always offer monthly online health challenges through our wellness platform. The ongoing monthly challenges are going to include things like stress, sleep, and stress. Did I say that twice? Stress, steps, and sleep. And they are open to everybody. As we're getting ready for 2025, in December for HealthNet members, we have relationship rejuvenation. So this is having a healthy relationship means you can deal with difficulties while also honoring each other. So that is a 30-day challenge coming up in December. And last but not least, our December wellness webinar is Ease Your Mind with Nature. Please note it is on the second Wednesday of the month in December due to the holidays. And during this webinar, we're going to explore mental health benefits of nature. So how to incorporate nature into our daily life, whether indoors or outdoors. And we'll also explore some therapeutic techniques such as forest bathing. We're also going to listen to some relaxing, soothing nature scenes, looking at those and also hear the sounds. And we're going to be discovering the science behind nature's calming effects. So we'll be in the throes of the holiday season. So this is going to be a great one to help you to relax and enjoy the holiday season. And that is it for today. So we thank you so much for your time. Do keep in mind, everyone who registered for this webinar will receive a link to the recording in just a few days. So again, thank you for your time today, and you may now exit the webinar.
Thank you so much.
Thank you.